With the onset of COVID, we've been forced to make some changes, and the changes are such that there's a little bit of fear in the public eye that they can't come into our building to make arrangements, that there's questions on how funerals can happen, how visitations can happen, whether they can happen in the present time or whether it's best to wait until we find out that these restrictions are lifted. Currently, we have adopted, for the safety of our staff and for the safety of the public, we've locked the doors. However, there's always somebody here to meet with somebody or to take the phone calls, to respond to the needs of the families where somebody's passed at home, if they passed away at a hospital or nursing home. So there's always somebody to look after what needs to be done. So we treat a COVID patient any way that we would treat any other infectious disease. Funeral homes are equipped with personal protective equipment, masks, goggles, gowns. We do embalming, and that is part of what we would wear during an embalming process. So to treat somebody any differently would be not keeping ourselves safe. I will say that I don't think any funeral home in the province of Ontario was prepared for COVID, and the increased requirement, need for more than what they probably have on stock has been probably the most difficult, trying to find extra masks to be prepared, because nobody knows truly when this will end, and if a supply isn't kept up, then we run into the position of looking at other funeral homes to lean on them for help. As it stands, certain protocols have changed at nursing homes, retirement facilities, hospitals, and hospice, where our staff now attend to the door of the building, and there are staff at the institution that will take our equipment, our stretcher, to retrieve the deceased from wherever they may be, in their room, in the morgue at the hospital if that were the case, and they would return the stretcher and the deceased to us at the door. It prevents us from possibly bringing COVID or anything else into the building, but it also helps prevent and keep us safe by not entering a building that may have an area of contamination. The one area that has not changed is when somebody passes away at home. We still send 2 staff to the home to bring the deceased out of the home safely. We do have some screening questions that we would ask the family ahead of going to the residence. The difficulty has been that we're now in a position where we have to explain to people limitations on what they can do. Where prior to COVID, it was a joy for us to be able to tell families what they can do to celebrate the life of the ones that they've lost. So as it currently stands, the province has guided our industry to say that 10 people can attend at the funeral home. That means that 10 family members or 10 people that have been designated by a family can come in to pay their respects at any given time. So it gets to be a little more difficult. These restrictions are extended to the cemetery as well. And therein lies, from a funeral director standpoint, the difficult nature of having to tell somebody no, or you will have limitations. Where arrangements are required, we do have all the legal documentation that has to be filed before we can even move to have a service or have a burial or cremation. We've adopted DocuSign, which is just an online portal so that we can send the required documents to somebody to their home. So they're still getting the expert advice and the guidance through the whole process. It's just not in a face-to-face manner. And that for us is tough, because we want to be able to see people, to have their reaction, to have them in the building to make choices on what urn would you like to place the ashes in, what casket would you like to choose. It's a lot more difficult to do that by way of a photograph than it is to actually be in our selection room to be able to choose by seeing and maybe even touching, the fabric of the casket, or holding the urn to see if it's the right choice. What we've seen recently, and it's more so, I think, to the acceptance that COVID isn't going away anytime quick, is that people are now understanding that they have to live with the restrictions that are in place. And people are a little more accepting that a funeral of 10 people that could be video broadcast to other family members is an option. A visitation in the chapel is an option. We can link to, you know, your what is it, the Zoom or FaceTime, and we've had people. The very first spring burial we had this year was a family member from British Columbia that couldn't be here, so we had him on FaceTime, and you know, he was quite emotional on the other end that he couldn't be there, but he was kind of there in as close a manner as he possibly could. And so we're trying to bridge the gap of distance and keeping people involved in different ways.